People don't seem to understand the variety of services offered by the Ministry of Health. Many people just see what we call perhaps the end product, the doctors and the nurses taking care of you should you fall sick. But there are a lot of other aspects that need to be properly integrated for this to work. And I found out that many of my executive team, while being here for many years, had not even been out to the actual health centers. They didn't know them. They knew they existed. They were there perhaps when we started them off. But we keep hearing complaints. And I think that if you don't go down and see it for yourself, it doesn't come home to you. And therefore I mandated, and it sounds bad to say a minister mandated, but we did it. And the PS supported me and the Chief Medical Officer, Dr. Anton Kamabach, that every member of our executive team will make an effort and go out and give me a report on what they thought could be fixed at these various health centers. Because you remember when I came in now, we were operating without a board. So we like the oversight of the board. And they did that. They went out and we found some quick things that needed to be done, some simple infrastructure things. And they started to work on that 120-day plan. But with the Ministry of Health, we have 5 REGs. The Eastern Regional Health Authority, which goes from Rima to Miaro. Then we have the North Central, which actually goes like from Chaguanas, Barataria, kind of, all the way up to Rima. And many times people assume that Arima is not part of the North Central. We tend to know North Central as being primarily Mount Hope Hospital, Eric Williams Medical Science Complex, Wendy Fitzwilliams. There's so much more to it. Then we also had what we call the Northwest Regional Health Authority, which actually takes everything beyond Barataria till the west side of, it was the west to the east, all the way down Caranaj, Chagaramas. They take care of all that. And then, of course, the biggest one, Southwest Regional Health Authority, which is like caters for over 600,000 patients, which is a massive thing. It only has a 650-bed hospital, which you'll hear more of later on. And then, of course, the TRHA. And we decided we needed to get on board and see what was going on. And it was really amazing how the executive staff got on board. They were coming in with their reports, enthusiastic. I mean, some of them made it a trip. They're going out to the far places, and I saw them leaving with coolers because they're going to this far trip. And they were really excited that they were getting a chance to make a difference. There are a lot of people waiting for surgeries. And it's something we have been actively pursuing. And people write me and say, oh, Minister, my surgery was scheduled for 2012. And I need it now. The thing is, as a Minister of Health, I cannot tell someone, oh, put her surgery earlier, or put his surgery earlier. That would be wrong if any Minister of Health did that. I'm not a doctor, and I am not going to play God with someone's life. But what we always say is that the doctors who are seeing you can assess the urgency of it. And then we're working on actively, what was the problem? At North Central, what we discovered was the number of theaters, operating theaters, weren't functioning. So what could we do to get those things to function? Because they can make special requests to the Ministry of Health, which they did. We looked at beds, because you always hear, we don't have enough beds in Trinidad and Tobago. And I myself thought we just didn't have enough beds, and I asked the Permanent Secretary, Sandra Jones, I said, can we not just buy more beds? And she said, yes, we can, we have beds. In fact, we have beds there, but it's not just bed, it's actually the infrastructure to be built to put the beds in. What they do abroad, and we try to introduce here, is right away we did that, and the CMO was fully in thing, is actually rating patients by different levels. So you triage them accordingly. So therefore, if there is a need for a major emergency comes in and you need to get patients out, the different categories that can be moved out to allow this bed usage to come out. And that has worked fantastically. I found out that a lot of our money was going into the private sector because when a patient came and there was no bed, we just sent them to the private sector and we paid for it. And sometimes people were saying that maybe that was not the best expenditure of taxpayer money. So all these things have been alleviated and saving taxpayers money so I could put it into other areas. Many women in Trinidad and Tobago, Caribbean people especially, have a fear when they get breast cancer. It's the end of their lives because they don't seem to want to get rid of the cancer because they believe if they get rid of the breast, they have lost their womanhood. And a lot, because society judges you a lot by what you look at. And we did that. Today I was there, as I said, and we have now introduced a machine that can give you your results on the blood in 2 minutes. It can do up to 12 patients in 2 minutes. A lot of technology I'm bringing in. If we move again with technology, you will see that one of the accomplishments we got is government to agree 1 patient, 1 record. And that's a great accomplishment. It was alarming to know that you can go to one RHA and request assistance in an emergency, and you will be a diabetic, and the other RHA would have known that. But guess what? This RHA didn't, because we don't have 1 patient, 1 record. Everything is manual. In some RHAs, a patient would have multiple records. And this leads to a lot of confusion. People are using our system. And yes, we are seeing, you might be seeing some complaints coming out. People have gotten the faith in this system because they believe that this government really cares. When I walk through groceries, that's the only place I get to go. People come up to me and they tell me what the changes they are seeing. We have got a decrease in the waiting time to go to the hospital. Does it mean that every single time you go into a hospital, you will not have to wait long? No, but we have gotten that standard down. International standard tells me it's 2 hours to 4 hours. That's long. And we're working hard to get that down to what we consider acceptable. It shouldn't really be more than half an hour. But there are days when it goes astray, and we tighten up that. One of the things that's great is what I call regional health authority reform. One of the things we realized that many times the ministers of health and the government, by extension, is held accountable for the service delivery at the hospitals, at the health centres, at the health facilities, because there are 3 strands that we offer. And really and truly, it was unfair because there was an absence of service level agreements. And one of the main things we did was that we actually formulated a service level agreement. And as soon as we got the regional health authority boards formed, they were made to sign the service level agreement. The chairman, the CEO, and the Minister of Health via the PS. If I am going to be a responsible Minister of Health, I have to give people that assurance that when they go into a hospital or a private healthcare facility, it has that standard. The same way the government has been doing accreditation for education, we are accrediting these private clinics where people are going in and some are dying. And even in our own hospitals, they have to meet certain standards. So the accreditation bill was done. What we've done is that a results-based management system has been developed for the health sector. Because again, you have to set targets. If you don't set targets, then people don't know what they need to accomplish. And then anything goes, which is what we've been having. Another aspects we did was the oral health policy. We do have a number of dentists out there. It's just to get them to come into the public system and work. And if I can get more into the public system, then I can offer more of those services. So we drafted an oral health policy, and we have sent it to the Dental Council and to the dentists. We have put it out on the website for them to give us some feedback. We also looked at a revised infection control manual. And that wasn't because our infection control was that bad. But everything needs improvement. The day you stop learning, you stop living. And I'm very proud to say that PAHO actually found that the way we were doing infection control was so good that they brought people from other countries now to look at our method of handling infection control. We also looked at the mental health workplace policy. And in that place, we recognize that many times in Trinidad and Tobago, mental health is thrown to the side. The best practice approach is to actually have it what we call decentralized, move out into the areas. People recover better, surrounded by loved ones. Right now in Trinidad and Tobago, I met a system where everyone who's deemed mentally ill is sent to St. Anne's. And they have a variety of levels of mental illness. We have seen, like I said, a reduction in waiting lists in cataract surgery. We have done fantastic things. We have partnered with America, brought in teams to look at the whole issue of doing cataract surgery. Yes, we haven't been able to do the 500 a day that people want, but we are not going to rush something until everything is in order, because I don't want to say, fine, look, we did 500 cataract surgeries today, and then there's some problems developing later on. So all these things we are looking at, but we have done some revolutionary surgeries, which I have mentioned, with corneal transplants, things that people normally had to go abroad for, they can now do in Trinidad and Tobago. As a Minister of Health, when a citizen applies for medical aid, and we have given out millions of dollars in medical aid, it's like 3.5 million is the average every month I give out in medical aid. And that is for people who are doing surgeries or services that are not available in our public health system, because not everything will be catered for. And people ask me, why can't you get everything in Trinidad and Tobago? And I keep reminding people, you hear many times people live in one state in America and they have to go to another state to seek treatment. Because the thing is, you want that treatment to be given at the best location. So not everything can be done at one location. And we formed that Children's Life Fund, and we have assisted over 24 children. Nearly $6 million has been given out already. On May the 4th, I handed members of the board their papers to say, yes, I'm on the board of the Children's Life Fund. And they selected their chairman. And we're going to have a formal launch of that. And we're going to show them on location. NCRHA came on board and we have found the location for them. And they're going to be up and fully running by the end of June. Because we have strengthened these ties with PAHO, we have seen PAHO looking at all these systems that we need to fix. We need to fix things like CDAP. CDAP needs to be fixed. We're tired of hearing complaints. So the Ministry of Health has already brought on board, we went off to a tender, we got a consultant on board, and we're looking at this whole CDAP, this chronic disease assistance program. Another thing we looked at, we discovered there's something called C40 in that drug program, and in that we had to actually look at decentralizing. Why should all drugs be kept in chagaramas? That access, if something happens to that access, this country is cut off from its drugs. So I went to Cabinet again, and Cabinet has approved that. This decentralization, delivering the healthcare the true way the RHA was set up. What we had to do was the Prime Minister asked each ministry to develop a 5-year strategic plan. And we looked at things that we were doing like the hospitals. And by the way, the Ministry of Health was the first ministry to deliver its strategic plan. One thing I must praise people here working is their dedication to seeing it and being all they can be. We sometimes knock public servants and say, oh, public servants are lazy. I haven't encountered that in my executive team here and their support staff. They work really hard. And work in health is 24/7. There's nothing like time off. My PS, my CMO, and I are on the phone at 11 o'clock talking because health doesn't know a time off to get sick. People need help all the time. And we are moving forward. The hospitals are coming. You would recall the Prime Minister talked about the Children's Hospital. We're looking at that aspect because we have been approached by organizations willing to fund this. We have the hospitals in Point Fortin. I am amongst 5 different hospitals. Point Fortin, we talk about Sandy Grande. Everything is coming on board. We are giving the people what we promised. But we're also looking for the recruitment of more medical personnel because the country has a shortfall. We have linked with the Ministry of Science, Technology and Tertiary Education. Minister Karim, what he has done is he has asked us to supply a projection, and that's something the ministry wasn't doing in the past, projecting what our future needs are, and they are working to have that staff in there for us, and they're going to be expanding. I've been selected by PAHO to be the Vice President of the World Health Assembly. I've been nominated by them, and I go up to Geneva later this month to actually go through the actual process of actually being placed into that role. And it's a very, very important position for Trinidad and Tobago. And it actually is kudos to the Prime Minister, because if the Prime Minister had not selected me and placed me in this position, I would not have been here when they did the rounds in July, when they were auditing ministers of health, and actually they said they were interviewing us to see who they will select, because they had certain criteria. They wanted a person, and they wanted a strong character. They wanted someone who had experience in terms of delivery, and delivery not necessarily specifically to that ministry, but delivery to the people, and that belief and commitment to seeing our service better. And guess what? I was selected, but I wouldn't have been there if I hadn't been selected by the Prime Minister. And this just leads me to say what I always say in regards to everything I do, is that my motto in life, and I got this motto, I read it before, and it's not something original to me, but it's something I've lived my life as, is being passionate about what you do is the key to success. And using that passion to help others is the key to happiness. And as we come to the end of this first day of the People's Partnership Government, being in power, and we continue onwards for a very long time, all I can see is this Ministry of Health is going to grow, is going to deliver to our nationals what we have promised, a first-class healthcare service. And that can only be done in a collaboration between us, the government, and you, the people.